Hello doctors, have a beautiful day. Today we are looking at the complications of TPN, that is the total parenteral nutrition. So firstly, the heading would be which is related to the nutrient deficiency. So this is a complication, that is the hypoglycemia, hypocalcemia, the hypophosphatemia, that is the refeeding syndrome. Next, in case of chronic deficiency syndromes, so in case of the chronic deficiency syndromes, this involves the essential fatty acids as well as zinc, minerals and the trace elements. Next is related to the overfeeding. So in case of overfeeding, there can be excess of glucose. This results in the hyperglycemia, hyperosmolar dehydration, as well as the hepatic steatosis, hypercapnia, as well as increase in the sympathetic activity and fluid retention, as well as the electrolyte abnormalities. Next, looking at in case of excess fat, what is seen is that excess fat, this leads to the hypercholesterolemia as well as the formation of lipoprotein X as well as the hypertriglyceridemia and the hypersensitivity reactions. Next, we are looking at the amino acids. So in case of the excess amino acids, it leads to the hyperchloremic metabolic acidosis as well as the hypercalcemia, amino acidemia and as well as the uremia. Next, we are looking at what it is related to the sepsis. So in terms of sepsis, it can relate to the catheter related sepsis as well as a possible increased predisposition to the systemic sepsis. Now related to the IV line. So on IV line, on insertion, it can lead to the pneumothorax as well as the damage to the adjacent artery. It can also lead to the air embolism, then the thoracic duct damage, cardiac perforation or the tamponade. Next, also the pleural effusion and the hydromediastinum. Next, we are looking at the long-term use of the IV line. So in case of long-term use, it can lead to the occlusion as well as a venous thrombosis. Next, we are looking at what is related to the motility. So this includes the cholestasis as well as the gallstones.